So as chair of the ESC Digital Committee, it's a great pleasure to try and coordinate the activities of the European Society of Cardiology in the modern digital healthcare environment. Because I think a lot of times professional organisations and doctors and other health professionals are pretty passive when it comes to new technology and new ways of working. And what we're saying is that we are a very valid voice in the discussion and co-design of new ways of working. So it's a great pleasure at the ESC to try and coordinate that activity and talent. So the ESC's had a digital area in its main conference in August, September every year, where we share new technologies, we discuss some of the issues, but that's for a broad audience of people who are kind of interested, but not necessarily very expert in that. We thought we needed to do a summit where we brought together people that were more involved in digital transformation and also have conversations together. So it's not just cardiologists at the summit, there are tech developers, regulators, reimbursement folks, but also patient advocates and patient groups. So we want to all have a conversation in the same room about AI, about the ethics, about cybersecurity, about training the workforce, about digital empowerment, so that we're all discussing the same issues together rather than in separate rooms. Well, the first Digital Summit in Tallinn in October 2019 was hugely successful. It was a great venue, there was a lot of interactivity. So the second edition in October 2020 will be larger. It will also be in Tallinn, and we will move each year to a bigger and bolder offering. And I think we want to bring in all of the communities that are relevant to digital care, not just cardiologists, but everybody else that are key stakeholders in that process. Let's all move forward together, exploring the opportunities and overcoming some of the challenges and being realistic about what we can achieve. We chose Tallinn specifically for the first ESC Digital Summit because Estonia is one of the most digital countries in the whole of Europe. It had to reinvent all of its infrastructure after the collapse of communism. So everything is digital here. There's e-prescribing, there's e-records, patients can access all the information from wherever. You can even become an e-citizen of Estonia. And we had huge support from the Estonian Cardiology Society and also the Prime Minister's office here. So it was a great pleasure to come to it and to a very cool venue where we were able to have a very good discussion about digital health. So I don't see digital as replacing what we've got. I don't like the word disruption either. I think it's transformational, it's supportive. So I would really like, when I interact with patients and their families, to have a wide range of options in terms of supporting them to make the right decisions, learning about their condition and living with that. Some of that will be face-to-face, but it would be so great to have a blended approach where some of that could be remotely, some video consultation or telephone consultation, but also to prescribe an app to help with the situation, or even have an avatar who could help explain again the things that I thought were key and interact with the patient. So a blended approach where we use the best of modern technology to support the age-old relationship between a physician and the patient.